How are we? I know you've all been stuck in traffic with the accidents, so.
Still a lot of May, yes, good, thank you. No problem. Okay, make it pictures.
Well, good morning, Queensland. Good news that we've only had one new case overnight, overseas acquired and in hotel quarantine. We have 39 current active cases and we have had 8,938 tests overnight. So I want to again continue to thank people for coming out and getting tested, and keep reinforcing that if you have any symptoms whatsoever anywhere in Queensland, we want you to come out and get tested. And of course there's testing clinics open across Queensland on the weekend. Vaccinations, we've had 13,895 vaccinations yesterday, and of course we've got a number of vaccination clinics open today and tomorrow. We expect to hit record numbers over this 7 days again this week. So we encourage people in the 1A, 1B cohort and also those 40 to 59 years old to come out to get bookings and to go to our community vaccination hubs. And of course, if you are 60 plus, please make a booking with your GP, have a discussion with your GP, and we want you to get vaccinated. So of course AstraZeneca is being made available for those 60 plus. It is important that we all get vaccinated as quickly as possible. Now, yesterday, great news for Queensland. We lifted a number of restrictions, which means we now have the lowest restrictions in Queensland that we have had since the start of COVID. We've also lifted our hotspots for Greater Melbourne, which means anyone from Victoria can now visit Queensland. We remind all travellers and also Queensland residents who have travelled outside the state and are coming back, you must apply for a travel declaration within 3 days of travel. We also have changed the changes around the borders. So previously, people within a certain distance of the New South Wales-Queensland border didn't need a travel declaration. You are now required to have a travel declaration. That travel declaration will last a fortnight, so you aren't needing to renew that every day, but it's really important we know when people are travelling into Queensland, so that if there is any community cases that are showing up in those northern New South Wales communities, that we can notify you as soon as possible. We have also, of course, put in place new restrictions around 4 local government areas in New South Wales. This mirrors New South Wales hotspot declaration, and for those people who have been in those 4 LGAs since the 11th of June, you must follow the instructions about staying at home and only leaving for a very small number of reasons. And of course, for the other local government areas, there was 35 in total that Queensland has declared. If you have been to any of those local government areas since the 24th of June, you must also follow the instructions about the restrictions. And of course, if you've been in a hotspot, you cannot come to Queensland unless you are a Queensland resident or you have an exemption, and any of those people will need to go into hotel quarantine. I want to reiterate the 4 particular local government areas: Waverley, Woolloomooloo, Randwick and the City of Sydney. Now, there are maps of those local government areas on the Queensland COVID website if you are unsure whether you have been in those areas. It's not just about a matter of your postcode, but it's a matter of which local government council area you are in. So for those who live in those areas, they know who their local council is, so they'll be able to quickly know whether they're in one of those 4 local government areas or those broader 35 local government areas. For those who are residents, you can check with whoever you were staying with what local government area it was to know whether you need to comply with these restrictions. Great news also with the check-in app, which was broadened yesterday. The list of businesses is up on the website. Although it came into effect 1 a.m. yesterday morning, we remind businesses that for the next fortnight, it's all about education and awareness, not about enforcement. We want to work with businesses, but as I wander around Redcliffe Peninsula, our shopping centres, our cafes and restaurants, they've all got the Queensland check-in app up, and I want to thank them for that. I can give some numbers. We've had 60,761 locations and venues register in the last week for the Queensland check-in app. Since we started our new check-in app, 69.5 million check-in customers have been registered, and we've had 3.6 million devices downloaded with the check-in app. So that's fantastic numbers, and we encourage people to keep downloading the app, and for businesses to make sure that they've got the QR code up and highly visible for people to find as soon as they walk into venues, even before they sit down. I'll hand over to Dr. Young now, and then we'll take questions. Dr. Young.
Thank you. So no new community cases in Queensland overnight, which is absolutely excellent, and a lot of testing has been happening. So thank you to every single person who's come forward and got tested. That is critical. I know we're in our winter season of sniffles and colds and so forth, but please keep coming and getting tested if you have any symptoms at all, because I really don't know where we might see a case. We've done so much work, and every Queenslander has done so much work to protect each other, but it's really important to keep coming forward and get tested. Now, the other thing people are really doing is coming forward and getting vaccinated. 71% of Queenslanders aged 70 years or older have now had at least their first dose of the vaccine, which is excellent. So please, could people keep coming forward? Keep checking the website if you're in that 40 to 59-year-old age group. We still do have vacant bookings at some of our vaccine clinics here in the southeast corner and through the state. So come forward and get your vaccine. If you're 60 years or older, please see your GP. If you've had one dose of the AstraZeneca or the Pfizer, it is really important to come and get that second dose. So I'm having my second dose of the AstraZeneca on the 31st of August. That's all booked in with my GP. So please make sure you're booked in to get the second dose. One dose does not give you sufficient protection. You need that second dose. That's very important. Now, we've all seen that New South Wales has put in place those stay-at-home orders for anyone who's been in those 4 LGAs of Randwick, Waverley, Woollahra, or the city of Sydney, those 4 LGAs, since the 11th of June. The 11th of June is when that gentleman who works as a limousine driver was out infectious in the community. So that's really, it's a critical date. So anyone who has been in Sydney since the 11th of June, please check where you were in Sydney. And if you were in one of those 4 LGAs, you now must be, as of 1 a.m. this morning, no matter where you are in the country essentially, in lockdown, at home, wherever your home is. So in Queensland, we are following those requirements. Now, you need to stay there because you have not continued to remain in those risk areas. You only need to stay in that lockdown position here in Queensland for 14 days after you left one of those 4 LGAs, or for 7 days, which New South Wales has declared, whichever is the shortest. So if your 14 days comes up before the 7 days, you can then leave. That's a very complicated, I realise, so please look at our website for that information. But essentially, anyone who's been down in New South Wales since the 11th of June, could you please check our website to make sure you haven't been in a venue of concern, an LGA of concern, or anywhere that we are really worried about. So please reconsider, because this is so complicated and it's continuing to evolve. So please reconsider your need to travel down into New South Wales at this time. It is far better if you could stay in Queensland rather than have to manage this complicated process when coming back into Queensland. So we have asked everyone to start using those traveller declaration passes so we know where people have been, so we can try and help you sort through this complication by texting you if we know that you've been in any of those areas. So that's why we need you to fill those passes out going forwards. And it's extremely important that everyone does this, because we know that the Delta variant of the virus is incredibly infectious. You only need 5 seconds contact with an infected person to potentially acquire it. And that's why we have to ramp up everything we're doing. But people have dealt with this for now 18 months and will know what to do going forward. Thank you.
Sorry, do we know how many people from those 4 LGAs in Sydney are already in Queensland?
No, because we didn't have that traveller declaration pass in place. So that's why I'm saying to people, just come forward and get tested if you have any symptoms. We don't know whether there are people in Queensland who might have been in one of those LGAs, mightn't have heard all of the news. Thank you to the media. You've been absolutely brilliant at getting this information out. But sometimes when you come up and come on holidays, you don't necessarily follow all the news. So it's really important. The most important thing all of us can do to protect ourselves and each other is to get tested if we have any symptoms.
Is there any way of estimating how many people you would like to see at home following these rules?
I just want anyone who's been in one of those 4 LGAs since the 11th of June to be at home and to stay there for 14 days after they left. So some people, it'll only be 1 or 2 days because they left on the 11th of June. Other people who left there more recently, it will be at least a week.
This threat coming out of New South Wales, it seems like they are still on the rise. This is going to be something that's going to be a threat to Queensland for quite some time, isn't it?
It could be, but we do know how to respond. We've done that time and time again. So as I keep saying, I can't emphasise it enough. Please get tested if you have any symptoms. All of our fever clinics across the state are opening. They're ready to surge if there are more people who come forward. So please, just come forward and get tested.
Dr. Young, the Killian family, which we
Yes.
saw, so that was very good that he got to see his dad. There was another example we had last night, a Dave family, the nursing home said, happy to have this daughter come from London, we'll put measures in place.
Yeah.
Sadly, she had to watch him die on Skype. I know it's very sad, but has there been a change in policy? Why is that different to the Killian family?
It's no different. So we've said now that we have a new process in place. We will move people to one of our 5 networked hospitals. So we have 5 hospitals that have developed a lot of expertise in managing COVID cases. They are the Royal Brisbane Hospital, the Prince Charles, Gold Coast, Sunshine Coast and Cairns. So anyone who does want to see someone, they're unfortunately at end of life, can be moved to one of those 5 hospitals, and then we can organise if that person can come safely from another state, if they've ended up in quarantine in another state. And so the Killian family chartered a plane to safely get, and New South Wales supervised that process to make sure no one was put at risk, because of course our national policy in Australia today is that you must quarantine for 14 days at your port of arrival, but we worked with New South Wales to enable that couple to safely charter a flight, manage the risks there, come into Queensland, and we safely managed their transfer to the Gold Coast Hospital, where the gentleman who's unfortunately towards end of life was transferred. We can do that for other people as well, and that is a change in process.
Yes,
You're
just one
correct.
follow-up. Is there the teething problems there because an hour later this family was told that the change in policy, that man died? Are there teething problems
Well,
there?
it takes more than an hour, unfortunately, to go and organise that. So people, the best advice I've got is that if people do want to see relatives towards end of life, as soon as they know that person is towards end of life, they need to go to the Commonwealth and to get a visa to enter the country. So there are processes there. They need to start that work as quickly as they can, because we know that's actually quite a lengthy process. Our process can be put in place quite quickly. The lengthier part is getting that exemption from the Commonwealth, and they should travel as soon as they can.
Dr. Young, I understand that in Sydney that there are cases that have been picked up beyond those 4 LGA
Yes.
areas. Are you confident that the measures you're putting in place will be enough?
I am confident, because we have now declared all 35 LGAs of not only metropolitan Sydney, but the surrounding LGAs of Wollongong, Shell Harbour, Blue Mountains and Central Coast. So people will need an exemption from any of those LGAs from the 24th of June to come into Queensland, unless of course they're a Queensland resident. But all of those people need to go into hotel quarantine, and I'm confident that that will protect Queenslanders. Yes, thank you for that.
Are you expecting to see cases though over the next little while here?
I am expecting to see cases, and as I've always said, I want to see the first case in the cluster. I mean, I cannot commend more what happened the other day with our Portuguese-related cluster, if I could call it that. Those 7 people have all been, the last several of them, in quarantine at the time that they were found to be cases and were not out in the community. So if we can find the earliest cases in a cluster, we can then have all of the other people in quarantine, as we did with that recent cluster, so they're not a threat to anyone. So we really and truly need to find the first case in a cluster, and then our contact tracers can get on with their business. And the fact that everyone is now using those Queensland check-in apps makes it so easy for us, because we can immediately, just instantaneously, get the data, send out a message to those people and say you're at risk. Whereas before, although businesses were amazingly cooperative, they were brilliant, it still took many hours to get that data, because the business had to pull it and compile it and give it to us, and it was always in a slightly different format. So now we can just do it so quickly, and that is so critical because this new virus is just spreading very quickly.
Are you concerned about state of origin?
Yesterday we went out to a shopping centre, and well, we spoke to a few people and we just observed what was going on there for a while. No one was using the check-in app going into the shopping centre. Are there any plans to improve, the communication about people's responsibilities?
Yes, so we are working with shopping centres, and I thank them. This is really difficult for them, but they're doing a great job. So it's variable, as you expect with a new process. So I know some Coles, my husband told me that the Coles he had to check in. So it's been implemented, and that's why we've got that 2-week grace period. But I know that people are taking this on board and doing it very quickly. And as you heard from the Minister, 3.6 million devices in Queensland have already downloaded the check-in app. That's fantastic. So we'll just continue to work with people how to download the check-in app. Once you've done that, it's really easy to check in. But for some people, it's a bit harder to download it. So I'd ask, please, grandkids, could you help your grandparents how to do this if they do have a phone? If they don't, there are processes in place, and I do thank the big supermarket chains who've been working with us. If people don't have a phone that they can use to check in, then the supermarkets will have systems in place that they can assist. Either that they check in for you on their devices in the business, or that they take it down on paper and transfer that information to an electronic database. I do want the vast majority of people to use the check-in app, because that is the quickest, safest way of us achieving this. But of course, it's harder for some people to achieve.
I might just add on that too. Can I say we'll have compliance officers out also just checking whether businesses have got the signage up. And whether they've registered for the check-in app. If they haven't, they'll be asking them why and making sure they've got the information they need to assist them in doing that. So as I say, it's an education and awareness process at this stage. It will get to a point that if employers or businesses are intentionally not displaying and registering with the app, then we may need to have enforcement. But at this stage, it's an education and awareness. As customers, if you don't see the Queensland check-in app anywhere around, by all means go up to some of the staff or the manager and say, where's the check-in app, or have you got the check-in app, just to remind them that this is something that they all should have in place. I also just want to reiterate what Dr. Young said. This is not the time to travel to New South Wales unless you need to go down there for essential reasons, and when you go down there you need to understand you may very well have to quarantine when you come back. But we are trying to tell people unless it's for essential reasons, you should not be travelling to New South Wales at this point in time. It's really important to understand that.
Minister, how will the satellite hospitals ease pressure on the health system if they've got no overnight beds?
Because it's all about early intervention. It's about treating conditions early and having them done. So day surgery, lots of day surgery. You think of all that day surgery where people are currently still taking up space in a room, and also surgical theatres that can be done in our satellite hospitals. So that's creating automatically extra space where there can be overnight beds created in our primary hospitals. But also, if people are getting treated quicker, then it means that their conditions are not becoming critical and chronic. And that's what we're seeing. We're seeing a lot of people coming in with chronic illness that is preventable. So our satellite hospitals will help people get treatment quicker and earlier and more local to their homes.
Minister, there was a death of a police officer on the Brisbane highway overnight.
Oh, look, can I say on behalf of all of the government, it's such a sad time. It's a tragic incident, and our thoughts and prayers go for this police officer's family, work colleagues and friends at this really difficult time. I know the police will have more to say and there'll be an investigation into this, but right now, can I say we just want to give our thoughts to the police officers' family and friends at this point.
The Same Workplace Health and Safety was already looking at the use of stingers following another case, and again last night the officer was using stingers when this has occurred. What needs to happen here?
Look, it's just too early to comment on the circumstances. This has just happened early hours of this morning. It will be investigated as it should be, and the QPS, I'm sure, will have more to say in relation to the details. But right now, we just want to give, our thoughts and prayers to the families and colleagues. Thank you.
Thank you.